Okay, thanks, Bibas, for organizing this. Really excited to be here. I'm relatively new to this community, and so definitely look forward to learning what you guys are doing. And today I'm going to talk about what I've been doing in Colombia organized through the roadmap working group and on digital health. So as I was flipping through the table of contents of the schedule of the talk, I realized that it's slightly different from what I had put down on the schedule with the precision health, because the idea at that time was, without knowing what I was going to talk about, I put down something really general. So today's talk is totally different. So I take out the precision, and it'll be actually more specific than what I put down on the abstract. And so the focus of the talk today is on an application where the goal is to build an intelligent recommender system for health apps. And so this is sort of the centerpiece of the talk. And for the application, I'm going to talk about two types of methodologies that are totally sort of orthogonal to each other. So the first methodology will be on a smart type of design that we can use as a data collection platform for this type of recommender system. The second methodology that I'll talk about is on what I call quantile coarsening of time series. So time series is actually probably one of the most important data type for data you can collect from mobile apps, right? Because you have streams of data, so which can always be modeled as time series. And in a way, I think what's important in this area is that it's not that we don't have a lot of data. The question is, how do we get important information from so much data that we don't need to, chances are for the entire time series, we don't need to have the entire time series. We just need to have a coarsened version of it, which is a dimension reduced version of the time series. So this is sort of the motivation for the second half of the talk on how to store time series data in a way that we actually preserve most of the information without getting too much of the bandwidth. So, but first I'd like to talk a little bit about roadmap, which is a research program at Columbia. It's a research program on using adaptive designs and mobile app platform to understand health and to support health. So really these are the two main purposes. One is to understand, meaning you have a big data set, you go in, analyze it, understand the health behavior. And the other goal is really to provide intervention to support health based on what we observe. So these are really the two main purposes of this roadmap working group. So it's very general, and I don't know whether it's shown clearly on the screen that we have a website from the school, and you can see a list of people and activities of the group. It's not very well manicured website, so we have very simple information there, but we're building up that group. So the group at Columbia Biostatistics mainly consists of faculty and students. We have about 8 people so far in the group, with people leaving, graduating, and so the activities of the group is on discussing methodology, algorithm, something that you expect what statistician would talk about in a working group. But we try we try to ground our projects on something that is based on real data. So we actually have established quite a few collaboration across institutions with different types of disciplines, from clinical psychologists, computer scientists, and informatics people. So this is again a web of collaborations across discipline. So this is so the type of problems that we deal with, again, is a wide range from producing data analysis based on data we collected from mobile health, mobile apps, and to the design of experiments. And we develop our own apps so that we can actually implement the algorithms that we develop. So we do not study pizza. You see pizza there. We do eat occasionally together, and no one is willing to show their face, so I put pizza inside our picture. So, but this is actually it's a fun a way to organize students and faculty to work on a single project together. So this is really a very brief overview of what we do for roadmap at Columbia. So now let's move to the application. So in this paper, we talk about we study the user engagement over 16-week period of 12 apps for users who are in need of apps for their depression symptoms or these anxiety disorders. So there are 12 apps. And each of these apps are developed by clinical psychologists based on well-established like theory in psychology and empirical evidence that those psychotherapy works. So with 12 apps, and then each one of the apps carries out very specific goal. It involves very simple interaction elements. So each one of them basically does its own thing. Just to give you some brief example, you see like this here. It looks like noodles. It's not noodles. It's a knot. So this app is called Worry Not. So the app is basically the idea of the app is that it helps through lesson practice and review of the lesson. Worry Not helps the user to deal with the entangled thinking that they get worried. For example, if you're worried about public speaking, giving a talk, recommend it. You should go to Worry Not, download it, free on Google Play and Apple Store, actually, App Store. So just go there and then download it. And then so this is an app that by certain module, you help the user to think through a neutral event and then how to tackle a negative feeling. So this is Worry Not. So this is one app, one of the 12 apps that we're going to talk about. Let's look at this one in the middle with a trophy on it. So this is called Daily Feeds. Daily Feeds is an app. This is a sort of a task-based app that asks the user to do a checklist of things. For example, if you're depressed, you probably want to hide yourself in a dark room, never eat, don't move. But what Daily Feeds does is that it gives you some tasks to do. To say, have you called a friend today? So if you did call your friend today, you check. So by going through this task list and then to review your progress, this is a way to encourage people who are particularly depressed to move out of the comfort zone, and then hopefully it will be better. So this is a different app. And as you can see, different people may need different apps. People who are anxious may not need Daily Feed. People who are depressed may not Worry Not. So the question is that with these 12 apps, how do we know which app to tell to patients? I mean, if you're a clinical psychologist, chances are that you know. But if there's no human, it's just a bot. We want to have a way to tell people which app to use based on what they are. And this is what the hub is about. So to organize the user experience of these 12 apps, we developed not we actually, so the main investigator I need to acknowledge is David Moore from Northwestern Center of Behavioral Intervention Technology. And so he led a team of clinical psychologists to develop the apps and this hub system to organize user experience. So one of the specific functions of the hub is to make recommendation. So through push notification. So you downloaded the hub, every week, actually, you'll push notification on this is the app that you want to download. So the question, of course, is how do we train the hub to be intelligent enough to know which app to use, right? So and the key is that because the way that human interact with apps is longitudinal, it's dynamic. So it's very natural to frame it as a reinforcement learning problem, and therefore we may actually use some sort of smart design as a data collection platform to train this hub to learn better. So just to illustrate the methodologies, I'm going to give a super simplified version of the smart that may be used to train the hub app, right? Because we're talking about 12 possible apps, but let's focus on just a few for now. With sort of what we call two-stage smart design, and at the first stage, when the person once the user download the hub app, the hub, let's say that you will it will randomize the user to either recommend the user for using worry not or daily feeds. And then depending, and if, let's say that once the user download the apps and they're using the apps, we can keep track with the app usage. That's not the problem. This is really what the time series data is about. Let's say we follow the app the user engagement for 6 weeks based on the user engagement. We make further randomization. So let's say that if the hub recommend worry not, and then if the users actually have some sort of usage, maybe we want to further add another app to worry not, so that there'll be more apps for the user to learn from. So this is a really a standard smart. And with all the with all the treatment options available, what we need to complete a smart design is to specify the randomization probability, right? So the simplest way to think about it is that initially we just randomize 50-50 to worry not of daily feed. So this simple. And the second stage, depending on what we observe, so let's suppose that we start with worry not, and then if the user actually is using the app, maybe we should ask the user to do more. So maybe with more high probability, we want to add one app to it, and then for like smaller probability, 30%, we just maintain the same app so as to help the user go through. And so you can basically, with this probability specified, we've completed a smart design, right? And then, yes. Yeah, so that's actually what happened. So this is, I need to emphasize, this is a super oversimplified version of it. And in actual, what happened actually in the apps is that the hub will, instead of every 6 weeks, so you will make recommendations every week. And then for each time, you recommend up to 2 apps. So you definitely, instead of like having 12 possible recommendations, you can actually 12 plus 12 choose 2 possible recommendations that and the hub can push out. So you can see that the actual smart, in order for this type of experiment, is going to have many arms. But I'm just putting this to illustrate. Otherwise, it'll be too busy. So yeah, so that's yeah. Mm-hmm. Right. I think I just made this up just for illustration, but in some, I don't think there's particular rationale to it. Yeah, you could argue that. Yeah, so I mean, this is something that, right? Yeah, so this is something that we would we would be able to argue, but we don't know, right? Because we can say that because that's actually the difficulty of running a smart for this type of app, training the app. Because how do we know which option to randomize to and with what probability? Whether we should assume there's a delay defect so that we give it more time, or we should just give up on the app and move on some other apps, right? So this is really the intrinsic difficulty of using a vanilla version of smart to train at the hub. So that's not adequate. So I've said what I have on this slide, except that spelling out smart. Of course, I assume that everyone in this room knows what smart is in capital letters, sequential multiple assignment randomized trial. And there's nothing new here except that I want to set a general notation that I use pi to specify the randomization probability of a smart. So again, this is the design parameter of a smart study. And a good talking point about why smart is good, because smart is smart in that it's a learning design. By virtual randomization, it allows us to first identify in that simplified smart design version what we call the optimal embedded dynamic treatment regimen, right? So, but what I think what we want more from a smart design is that it allows us to learn beyond the embedded dynamic treatment regimen, in that we did not talk about personalization. But we could use reinforcement learning to learn how to, depending on the baseline, for example, the baseline depression and anxiety scores, to make recommendation of the apps. So smart does allow us to answer all these questions, which is good. The limitation, of course, is that one of the limitations is an issue that Bibas brought up about how do we know how to put what probability to each app at each time point. And the other problem is that it's good learning design, but as an app, there's no feedback to the user. So in a way that the user experience is not going to be improved over time. So that's the main difficulty with using a smart. And of course, the curse of dimensionality is a question that Naiwa brought up. This is the actual smart diagram look like, that we have possibility more than one recommendation at each time point, and then instead of 2 stages, we're going to keep moving. So we need to deal with this difficulty when we want to use a smart type design to train the hub. So the apps, first they are available public for free, so everyone with or without anxiety disorder, with or without depression, can go and download it. So in terms of the study population, in the paper I mentioned at the beginning, it just include everyone who have ever downloaded the app. So we talk about over 10,000 users in just a matter of 6 months. So this is actually it's pretty impressive in terms of enrollment. But in terms of eventually what is the target population, the clinical investigator led by David, they're currently about to complete a randomized clinical trials in which they focus on subjects they need to meet certain anxiety and depression criteria at a baseline, and then they'll be brought back to clinical evaluation. So, as you can imagine, that for people like us who download the app from Google Play, we don't have the clinical evaluation part. We only have the app usage data, which can be tracked passively, and we also have some self-report data, which actually has some interesting analytical aspect that I think some of my colleagues will talk about this at another time. So I think eventually, of course, the goal of the analysis is to see whether this app is useful for people who need this, right? So this is answer the question. Great, thanks. Okay, so after all this introduction, I realized that the goal is how to train the hub to be a smart, to be intelligent recommender system. And smart is good, but not good enough. So we need something smarter. So for those who have seen this before, sorry, I have to do this. Introduce you to smarter. And so smart with adaptive randomization, which is a specific form of online learning. So the idea is that instead of using the smart with a pre-specified set of pi, the randomization probability, we just adapt the randomization probability throughout the user experience. So this is online learning, but this is a very specific form. So we are not trying to optimize learning. The goal is to improve user experience. So that's the primary goal. And I use the word adaptive randomization as a terminology used in clinical trials, which has, I think 1933 is sort of the earliest that I can find. Maybe there's something some people call adaptive randomization earlier than 1933. I don't know that. But the idea of additive randomization is to try to change the randomization probability in a way so that on average, users will be randomized to apps or treatments that empirically looks better. So the objective there is not to design randomization in a way to optimize certain learning criteria, but rather to really fairly simplistic, simple-mindedly to improve the user experience over time. And in the context of clinical trials, that was purely based on ethical considerations, right? Because people come into a trials, they're being randomized for drug A versus drug B, but if early on we see that drug A is not working, there's no reason why we want to keep enrolling patients to drug A. So we want to randomize more patients to drug B. So that was the ethical considerations in the context of clinical trials. And in the context of app development, I think user experience is important. So I don't know whether people here or where you're from use Waze as a way to do direction for cars. So if you use Waze, you realize that it's not always giving you the best route. I think what I was suspecting is that Waze is doing some sort of exploration, exploitation kind of thing. So and Smart is totally an exploration design, but Smarter is aimed to do some sort of exploitation while maintaining some exploration. So the concept of Smarter is very straightforward. So just to contrast, so instead of for regular Smart, the probability of randomizing to worry not at stage 1 will be 50-50 throughout the entire experiment. A Smarter, so this is a general paradigm. It's very good to randomize to worry not, say, in stage 1 with probability proportional to, let's say, Q1 of worry not with the function f. So Q1 here, as if you're using Q-learning, Q1 is the quality function in stage 1. So what it is really the expected reward for this action, given that you're assuming that your future actions are optimized. So basically, this is sort of the quality function in of this particular action or apps in stage 1, and then a very general paradigm is to set the randomization probability to be proportional to something of a function of this f is an increasing function. So the idea is that the higher the quality of an action, the more probability you want to assign to you. So it's fairly simple-minded, but I think it works. And so this is a general paradigm that's not tied to Q-learning. So you want to use A-learning, you replace it with some other objective function. But this is a very, very general idea. Yeah, so you could, but at least in my example, the action space is the same for everyone. And then in some situations, so the way I like to view it mathematically is that if user A1 and user 2 have different set of actions, I'll just put a union of the two action space so that, but then with randomization probability of 0 for some. So I think this mathematically that's more comprehensive. So, but it's a very general paradigm. In a way, it's good because it tells you what the idea is about. It's not good in the sense that you really need to be very specific about what this function is. So this is what we did in a paper we did with BBAS actually a few years ago, published in Biometrics in a non-M health context actually. So this is what we propose as a way to determine, to update our randomization probability pi. So again, it's done in the context of Q-learning. So QT is a quality function at time t based on history and the current action A. And then we estimate row head of the action A that is an exponential of this quality multiplied by some number, and then it's a scale parameter. So this is to make sure that this is a scale-free calculation. So again, the higher the quality, the larger the row is, and then the randomization probability is just the normalized value of row. So this is how we propose to optimize, not to optimize, to maximize the number of users assigned to action that works better based on the interim calculation of theta. So theta hat is sort of based on interim analysis. So in this paradigm, we have a design parameter B, which is sort of the control the greediness of this of the exploitation. The larger the B values, we will exploit the data more. So so that will to be real aggressive, that will get the next users or the next action so as to maximize the qualitative function. And so when B equals to 1, you just reduce smarter to the regular smart. So not as smarter, but still smart. Okay. So right. Right. So in the second stage, you can have like you don't have to app A, app B, and then app A or app B. So the second stage, you can have other configuration of the apps. So it's very right. Right, the reward here is cumulative usage experience. So for example, if we adapt at 6 weeks, we may want to look at what will be the sequence of action that will lead to maximizing the overall user engagement in 12 weeks. Yeah, so, yeah. Mm-hmm. Yeah. Okay, that's a good question. Do we have intuition for me? But yeah, so but the intuition again is that if B is large, then it's very greedy, right? So and yeah. Right. Right. Yeah. Yes. No, yeah, so I think that's interesting. I think this approach is very myopic, so we're nothing about, but I think you can definitely build some sort of like risk functions, including like future subjects. That might be able to build in for this type of design or modify, but again, that I would frame that in the context of like on how to create randomization probability so as to optimize certain estimation criteria, because in that context, like you think about backward induction, you want to find it in a way to minimize like mean squared error of future subjects, cumulative future subjects. But here it's really myopic. We're thinking about the current user. If possible, we want to give this person a good app rather than just learn from that person. So, but that's interesting thought. We can definitely talk more about that. Yeah, thanks. Mm-hmm. Right. Yeah. So So the question is that we can definitely get a very large B. I think the question was what is a large B, right? Because whether 100 is large or 1,000 is large. So yeah, and yeah. So that it. Right. Yeah. But this one is nothing to do with like the next slide is talking about how to use existing data to as a weighted decision. This is really how do we determine. Yeah, actually in the paper we did some simulation on. I remember the range of B is from 1, which is a regular smart, to all the way up to 100, and then it looks like that the larger the B, the more. It's still the better it performs in terms of aggressiveness. So I mean, in terms of maximizing the user experience. So maybe I have not explored B that's high enough yet. So that's something probably need to be looked at. And I need to repeat that it was done in 1915. So I mean 2015. So not 1915, but. And then this another tuning parameter, if you will, is what we call lambda. So lambda is a tuning parameter for situation when you think that you have a very you have a prior data set that you want to use. So if you have a set of pies you want to start your smarter with, you want to determine your randomization probability as a weighted average of the prior input and the estimate from the data. And then again, lambda is just a tuning parameter determining like how much you want to trust your prior, how much you want to trust your data. And it's easy to interpret lambda because it lives in a range of 0 to 1, with 0 meaning that we don't use a prior at all, with 1 indicate that 1 indicating that we use only prior. We don't adapt. And then if lambda is 0, then we only use the data. We don't account for prior. So lambda actually has much easier interpretation than B. But this is with respect to whether we want to use prior data as an input for smart. Right. Right. Mm-hmm. Right. 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 Okay. Thank you. So yeah, I wish. Mm-hmm. Right. 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 So this is fake base. Yeah. So I think like in the context, I'm trained as a statistician, right? So there are several ways that we view things that is in. Like for example, G looks like a fake likelihood, right? So basically, we get a lot of great ideas from the more classical way of thinking based on likelihood estimation, but I'm more pragmatic in that, use that intuition and then expand it. But I suspect that there'll be more formal way to formulate the question. That'd be interesting too, actually. Yeah. So this is smarter, and this is a single liner that you like to remember. Smarter is smarter than smart. And because this is what, as you can see, so this is a based on simulation, vertical axis indicate the user experience, in this case decrease in depression actually, over time, not over time, based on when you enter the study. So this is based on the first 100 users enter into the system, and then as you can see that when we use smarter, at the beginning, we need data to learn, right? So depending on how we specify the initial pi, this is the user experience in the early stage of the app. As more user comes in, we start to adapt. The user experience will increase over time on average, right? So this is a smarter. whereas the other smart, depending on whether you're lucky or not, that you specify the right set of pi. Sometimes you do better, sometimes you do worse, but you never learn. So this is really what we set out to do, using smarter to improve user experience. This is in a way not very surprising. What is somewhat surprising is that smarter is a better learning tool than smart. So that was a little bit unclear to me when I did the simulation wrong, but because the intuition is that in the context of clinical trials, so I carry a lot of experience from clinical trials, right? So the most powerful comparison will be one-to-one randomization. If you impose any additive randomization, you add noise, you decrease the power. So when I first looked at smarter, I would expect that, yes, we're going to improve upon the user experience with some loss in terms of estimation precision. So that was my expectation. But after I look at the simulation study, we win on user experience, but we also improve the variability in the estimation. So in the simulation, we run a regular smart, and we run a smarter and in 100 subjects, and then with different set of prior. All this design scheme will lead to fairly high value of the final estimate. But what is different is that smarter consistently, this is just one simulation scenario. In all the simulation scenarios, smarter indicates that there's a decrease in the variability in this estimated adjusted value. So this is counterintuitive to what I learned from clinical trials. And then at first, my instinct was that I must have done something wrong in the code. So I rechecked the code, everything was fine. And as it turns out, what happened was, this is a different animal than clinical trials. When we deal with like a smart where we have so many different arms, we're not dealing with two-arm comparison. What smarter actually does is that it would relocate resources away from trajectory or sequence that is not promising, so that we will have actually more users allocated to the best, maybe the second best, so that we're better resolution in distinguish the best and the second best. So by doing this, smarter is actually a better learning tool than smart. So this is somewhat, it was somewhat a surprise, but in retrospect, I think this is the right intuition. So remember, smarter is smarter than smart. Yeah, so value is the expected value of the outcome under a certain dynamic regimen, right? So that it has a scale dependent on the outcome. So it's just a way to normalize it so that it lives between 0 and 1, meaning that 0 will correspond to the value of the worst regimen, and 1 corresponds to the value of the best regimen. So you see that under all, and after 100 subjects, we use Q-learning under all 3 designs. It's pretty good learning tool in terms of for Q-learning. But the goal is to look at the bottom line where it's a much reduced variability when we use smarter. Yes. Yeah. Yes. Yeah, it's counterintuitive. Yeah. So in this simulation, it is a 2-stage smart. At each decision time point, there are 2 options. So basically, there are only 8 possible regimens that you can. So you're selecting 1 out of 8, right? So. Mm-hmm. Right. Yeah. If you increase, yeah. Right, exactly. Yes. Mm-hmm. Yeah. Right. Right. Yes, that you're right on, because this is the whole point about adaptive design. So the idea of adaptive design, at least in the context of clinical trials, is that if you have one single objective you want to maximize, we can do very well, very well. But if you're looking at different things, so if you do this adaptive randomization based on one outcome, but then the other investigator comes in, oh, I don't want to look at depression, I want to look at anxiety, get GHG, then it may not be doing well. But then the question, of course, is that if we do well in the planning stage to get like an expert opinion, say this is a compromise. This may be the weighted score that you want to look at. Oh, so. Okay. So slowly. Okay. So I think what I hear from you is that this will reduce the variability for one particular outcome if you look at that, right? But if we try to do this kind of adaptive randomization scheme for one particular outcome, but then another investigator comes in and say, I don't want to optimize this outcome. I want to optimize the other outcome. Yeah, and then if we use say Q-learning to learn about the other outcomes under this regimen, we may not get the right answer more effectively. That's a point well taken. This is actually exactly what the potential limitation of adaptive design is, that we need to call what we want to optimize at the beginning. If we're optimizing something that we didn't plan to under a randomization scheme, that may be suboptimal. That would be interesting work to see whether we can to somehow to be somewhere in the middle, to stay on the fence, so to speak, so that at the end, so then it goes back to, I think, design optimality, like A optimality, D optimality kind of. So whether we want to really find a design that optimizes certain outcome, or find design that give us, for example, to optimize the confidence ellipsoid, that kind of like the optimality stuff. So we could actually incorporate that idea in a smarter design. Great point. Mm-hmm. Right. So I think my belief is that in at least in the data that I've seen in the context of telecare, it's difficult to tell the best against the second best, right? But it is very easy to tell what is not working. You don't need a statistician to tell you that, but you do want to have something that's automated that would tell you that's not happening. So this is what I think what smarter might be useful, is that somehow we may actually change the adaptive randomization paradigm so that something that's a complete disaster is going to be out. So that may be the way to do it. Yeah, so I think the traditional optimality in experimental design is not prepared for this kind of dimensionality of treatments. I think that's the difficulty. So that's why, as a starter, we try something really quick and simple, very simple-minded. So I haven't seen anything that goes beyond two. Yeah. Yeah, it just escalated the escalation of dimensionality just changed the entire calculus that we have developed in statistics. So I think that's an opportunity. Yeah. Oh yeah, so there are two trials that I know of. One in non-small cell lung cancer, one is in breast cancers. I forgot which one is which, but both are run by folks at MD Anderson. So they use adaptive randomization in those. Not many. So they're talking about 4 or 5 treatment arms, one single stage. And then the dimension here is not only about the number of options, but also about the compounds across time, right? So that's another difficulty. Yeah, that would have been something I talk about today. Yeah. Yeah. Sure. No. Right. I've talked to a lot of collaborators at Columbia, and the context in epilepsy, that because we have so many different drugs that can be repurposed for epilepsy over time, this is a chronic problem. So they try, basically this is what they're interested in. Pharma, on the other hand, is difficult because pharmaceuticals companies, because the nuance here is that they don't want the drug look bad if they compare the drug to other companies, right? Because if you put them in this platform, what people should talk about platform, in one single trial, the company will be worried that, well, Lipitor looks worse than the other statin, and then it's not good. So that's the practical difficulty. It's not about this. Well, I think scientifically we're there, because even if we're talking about a few statins, there are not that many compared to mHealth, but so that can be handled, but it is the will of the companies or whether they're willing to contribute. So I think. Yeah. Yeah, yeah. Yeah. Oh. Perfect. Right. Yeah. 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 So that's. Yeah. 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 Yeah, that'd be very interesting. But I think for those contexts, I think I've seen companies do somewhat like a non-smart version of it. They just look at one stage, but just so in a way they don't account for delay effects. So I think that's what I see more common. So they just say, well, this is a second line population, randomize them, forget about the first line. I think I've seen that actually. Yeah. Yeah. But okay. Thanks for the interest. Let's for this. And so I have 5 minutes and I have second half of my talk. So let's make some adaptation here. So, but I try to be really brief on that. Okay, that's fine. Keep asking questions. I like that. I like that better than me finishing it. And this is really simple. Another simple solution to something that I think that looks complicated. So you saw this in one of the smart scheme that this is what we have for the tailoring variables and on how to determine like how to determine randomization of a second stage. And this is the type of data we see in time series, and usually they are non-negative app usage and they are multivariate. So the question is, how do we use these time series data as tailoring variable while accounting for the high dimensionality? Because in most of the cases in smart, we assume that there's this intermediate response. If it is response, then go this way. If non-response, go the other way. But in reality, this is the tailoring variable. How do we reduce the dimension of it? So that's the motivation in the context of this this IntelliCare Hub. Very simple notation. So let's assume that YT is a time series indexed by time by t, and S is the cumulative activity up to time t. And because Y here is non-negative, so S is increasing. So that's one of the key assumptions here, that Y is non-negative. And then we define TP to be the P quantile of activity time. So P is like 0.5, then it's the time that 50% of activity has been achieved. So this is how we define the quantile part of the quantile coarsening. And the idea of quantile coarsening again is to try to represent the time series into a fewer components so that we could use this for like tailoring. And so the proposal is to specify a set of P's, quantile we want to target at, and then just look at these K quantiles plus, of course, the magnitude of the of the activities. And so the proposal of quantile coarsening is to reduce the entire time series into K plus 1 components. And based on these K plus 1 component, we can actually reconstruct the entire time series using this as approximation. And to show you how it works, which is important, it's I show you this very simple example. So this is a time series. It's a time series of up to 84 days, I think 7 weeks. And so the black line here is the actual observed time series app usage. So you see that it's very common that start out with people use the apps and then they keep coming down. And then the red line is the quantile quotient function with k equals 3. So you see that it gives a very good approximation at the beginning here, that it captures where the activity is. It's sort of missing the second spike here. So this is only with k equals 3. But you see this is how it works, that for the entire function, we reduce it to chop into 3 pieces and then record the 3 time points and then the maximum activities. And then we see that the approximation towards the end here, where there's not much activity, is very poor. Again, this is only with k equals 3. ST max is the total activity at 84 days. What's that? Yeah. Yeah, oh yeah, so maybe it may be easier. So think about this as physical activity, that on one day you will have 40 minutes, right? So, and then ST max will be 1440, and ST max will be the total activities of the entire day. So so usually when we just look at daily activities, that will be the number that we use. But what I'm proposing here is that instead of just looking at step counts of the day. We look at step counts and also various quantile to see where the activities are. So that's the key point of looking at quantiles, the location. And the illustration here is that with k equals 3, we capture the activities here, but not quite here. But the thing is that we can increase k. So with k equal 5, it looks similar. Now with k equal 10, so if we represent the entire function or entire time series with k equals 10, 11 components, we see that now the quantile core function actually captured this, the highest activity as well as the spike of activity in this region. So this is again a very simple way to do quantile to reduce the time series into a finite number of components using quantile. And let me flip through it. And the motivation of this again is to reduce the dimension of time series. And the one feature about using quantile as a way to reduce dimension, as opposed to the other way, is that it actually captures where the activities is, in addition to the total activity. And the advantage of doing that is for many types of time series, we care about where the activities is, right? So we really don't care about where there's no activity. And we see that in this example with 84 data points, if we only use 11 data points, we sort of capture the entire time series. And this has implication in terms of the computation economy, in that if you want to do all this computation, data reduction on the device, instead of like sending the entire time series back to the server, do some sort of complicated computation, send it back to the device, it's important to have something relatively simple and to do. So this sort of on the device computing motivation for doing this, so that's the motivation of quantile coarsening. And there's some fairly simple, like low-hanging fruit in terms of theoretical properties, which I'm going to skip. So just to show you like how it works in other data set when we have step count data. Actually, this is these are the step counts of one single subject followed for over 200 days, and then and then each curve here represent the mean activity curve by weekday. So the question is, which one is Sunday? If I don't tell you, don't pretend you don't see the graph on the other side. So where is Sunday? The black is the Sunday. So this is again from midnight to 11:59 p.m. And on Sunday, we see like a spike in activity early. It's not early because it's late Saturday, right? So this is really where Sunday is. So you see that this is actually the mean activity on Sunday and then the other weekday, based on the entire 1440 minutes of activity. But the point of using quantile coarsening again is that for this type of time series, we don't need to store all 1400 data points in order to capture the time series. We just need a few. And so the point of this is that with k equal 19, 20 data points per day, we pretty much capture the pattern of this particular users, right? So we use only 1.3% of the original data just to capture the pattern. Again, the whole motivation of using quantile coarsening, number one, is to reduce the dimension so as to facilitate data storage and data transfer, which is expensive actually. If you want to like transfer data from the device to a server, there's a cost to it, depending on how big it is. So it's important to able to reduce the data storage as much as possible while preserving the feature. So in this case, we sort of look at the features. We still see Sunday early spike, so that's good. And going back to the motivation why we want to use quantile coarsening as a way to reduce the dimension and to produce a categories for tailoring. And we apply this approach to step counts instead of using app use to about 20,000 time series. And so with k equal to 19, so for each time series, we represent it with 20 data points. And then with the 20 data points, we just use some model-based clustering to identify cluster of activities. And then based on this 20,000 time series, we identify 8 clusters. And It's a pilot study, so it's not something that we're going to live by or die by. But what I found interesting is that we identified this cluster 5. It is the mean activity curve throughout the day from 0 hours to 24 hours. And then if you look at this, we see spikes in 8 a.m., noon, and 5 p.m. Guess what this cluster is associated with in our data set? Work. Yeah, for people who are employed is totally associated with this. Also, on the weekday and versus weekend, we see that this is a pattern that's associated with weekday versus weekend. And this is done without any input, human input. Basically, just focus on, look at the quantile and then do clustering based on the quantile. And the point of this illustration is to show that quantile coarsening is very good at, if your goal is to look at where the activities is, this is the way to represent data. If you want to look at some other interesting activity, feature of the time series, like periodicity, this is not the way to go. But if you want to zero in where the activities is, quantile coarsening is the way to go. And so again, I showed earlier, and we actually use quantile coarsening to build something called behavior signature in a separate project, but part of the roadmap activities, we'll be happy to talk about that, but I think I'm running out of time. And so this is essentially the talking point that I've talked about. I talk about smarter, and smart with quantile coarsening. So the whole motivation here is really because when we use a smart design in the vanilla version, everything is pre-specified. Your randomization probability is pre-specified. Your tailoring variable is pre-specified. We were asking a lot from the investigator about things that they really don't know, right? So the whole idea of this talk is talk about using adaptive randomization to change the randomization property, using quantile coarsening to update the tailoring variable. So this is the direction that we're trying to go at in building this intelligent recommender system. And so that's really what I've in mind now. And this is my last slide. And so I recognize that this is the week of the design. Next week will be analysis. And personally, I'm a design person because I'm a control freak in a way. I like to dictate people how to do stuff. But I like to define design in a broader context in M Health, because in the old days when we talk about design, we think about the investigator will know that, oh, this is the endpoint. Let's do a power calculation. Whether we want to do a 1:1 randomization ratio, 2:1 randomization ratio. These are sort of the classical way to think about experimental design from a statistician viewpoint, which is very important. But in the domain of M Health, what I realized is that we still need to rely on domain knowledge from clinical psychologists, but we also need to acknowledge that because simply by the sheer amount of data from M Health, they may not know as much as we expect we know from clinicians in the context of clinical trials. So the new meaning of design in this context is that we need to be hands-on at the beginning. So it's not only about sample size calculation, which is important. It's not only about how to change the randomization ratio. It's about how to define the endpoint, how to determine the variable, and what are the meaningful metrics that we need to consider. So this is really the challenge for us as a group, I think. With this, I'd like to thank again for organizing this and all the questions. Yeah. No, yeah, actually, before I started doing the quantile coarsening, I actually started with the moment, because you can view it as a distribution and then look at the moments, right? But one thing about moment, I forget why I abandoned the idea and then switched all the way to quantile. Yeah, I wish I remember the rationale, because for this kind of things, you start with something and then, but quantile is definitely better than moments. This is at least the intuition that I got from my personal experience. Yeah, no, yeah. 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 Yeah, because you think about heart rate variability, right? So you're nothing much, and then you're a bip, and then this is where exactly the quantile is identifying where the R interval, something like that. So this is what the quantile is about. And for moment, I for some reason I forgot. You blank on me why it doesn't work. But I truly started with I remember I call it the moment functional data as a folder, and then I switched to quantile without changing the name of folder. Yeah. Yeah. Yeah, tells them tools about that, and then they need to change it, the entire game. So, yeah. Yeah, so I'll be interested. Yeah, so but what would be the metrics to look at in terms of F1? Okay. Okay. Right. Right. Okay. Are there any published data on that so that I can really apply this and compare to whatever published already? Okay. Yeah, I love it. Okay. Yeah, I love to try actually. I think that's great because yeah, as I said, this is so one of my pet projects to begin with, and then I realized that this can be useful in the context of smart. So I think, but yeah, thanks. Yes. Yeah. Yeah, so if we have data that's coarser than the minute by minute level, right? So the question is whether we want to use quantile coarsening. I think that's already represent to me the real step count data is one from those like the old day, the pedometer that you vary, and then this gives you a truly continuous conceptually it gives you a continuous time series, right? Because for pedometer, you can actually live on continuum. Even the minute by minute is something that you already do some of the coarsening, right? So the question is that how much coarsening do you want to do? If your data already come in an hourly level, whether it is worth doing it. Because if you have hourly data, you're talking about 24 data points a day, maybe you should live with that. So I think the whole point of doing this data reduction is, so the whole point of doing data quantile coarsening is really how much is feasible in terms of data storage, and whether it's very cumbersome to feed into your learning algorithm with 24 data points or 20 data points, in my case. So at least in the data set, I think I choose 19 for a reason, because 19 look like the right way to summarize a data activity on a minute-by-minute level. So does it sort of answer your question? Yeah, but yeah. Okay. Yes. Yeah. Yeah, so that's always a risk of running a totally exploitation way of algorithm, right? So there are various ways to do it. I only propose this. This is really a soft way to do adaptive randomization. It's much softer than, for example, than the epsilon greedy. Because for epsilon greedy, you need to specify epsilon, and then and you somehow, in a way to avoid a situation that you can never come back, right? But the way that I construct, at least the specific version I construct the adaptive randomization, is that it allows you to come back. So eventually, each trajectory will get infinitely many people randomized to the arm, so that you will be able to answer questions as n grows indefinitely. So that's, of course, statisticians talking. And at one point, I think, you will say that had enough, so you may want to do some truncation. So my recommendation would be use some very soft adaptive randomization scheme, and then that will be sort of the artificial or the machine intelligence part. And then as human learn enough, you realize that arm is not going to work. You just truncate it. I think that drop it. Yeah. So I think that would be my practical recommendation on how to use adaptive randomization. But right.
The question I'm asking is that standard squad, you have vector squad, and you have to assume that it's phi 1, that is 1 minus phi 1. The question is that is there any way to estimate what is the summary optimal allocation probability
Oh.
phi 1 plus 1 minus phi 1, let's say, so that I again, when I say optimal,
Yeah.
is there any part which will be
That's the most smarter version. Yeah. Okay. Yeah. Yeah. Right. Right. Yeah. A lot to do as well. Yeah. 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 Right. Yeah, but my yeah, but I think the more classical experiment design is not really prepared for this kind of dimensionality. I think that's the thing. Yeah, I no. But so the concept is there, but I think yeah. So that's where actually where I start from. This I start from a clinical trial a background, so that to me this is natural to incorporate adaptive randomization in context of SWOT. So right, because but then I realized that it gave me both bad and good surprises. The high dimensionality is really tricky in terms of, because you can only reduce dimension to a certain level. You can reduce from like 1,000,000 to 2, right? So it's difficult. But on the other hand, the nice surprise is that the improvement in precision by using adaptive randomization is something that I never thought about in the context of clinical trial, where we all talk about 2 to 3 arms. So in clinical trials, the concept of adaptive experiment is that you're going to be adaptive, you increase your variance. So that's this trade-off. This is an insight that I actually gained in the context of M health when we have high dimension decision points, is that you're being adaptive, you improve your variance. So this is something that I have the intuition then, but it's actually not directly applicable. So this is an interesting adventure. So, but I think to answer, I think Joseph's question, I think for statisticians, we always have this like design people and then analysis people, and then right, and so that I think that's a different. Yeah, the A/B testing. Yeah. 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 So and another thing is another literature about adaptive design is how to do inference in a valid way after adaptation, right? So, but that's another different thing. Another interesting thought that Susan just made me think about that might be useful is in the context of adaptive designs in clinical trials, it's very important to know how to do valid inference, right? Because collecting data IID versus collecting data sequentially will have different implications on how you estimate the variance. And right, yeah. So that's another interesting area that might be, yeah. So that's so part of, I'm trying to work on, for example, after smarter, how do you do inference? Like whether Q-learning is actually the right thing to do. Yeah, yeah. Yeah, so tell people we need. Right. Yeah, right. 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 No. Right. No, I totally see. Okay. you should be on record, Susan. Okay, so I think I've eaten up all the time. Okay.